Cat scratch fever. Cat scratch fever, an infection caused by the Bartonella henslae bacteria. Almost half of all domestic cats carry these bacteria and can transmit it to humans through a scratch or bite. Cat scratch fever causes swelling of the lymph nodes, sore throat, fatigue, fever, chills, sweats, vomiting, loss of appetite, and weight loss. There is usually a little bump, a papule, which may be pus-filled, a pustule, at the site of the scratch. In people with immunodeficiency, cat scratch fever can progress to bacillary angiomatosis, a bacterial skin infection that can be treated with the antibiotics rifampin, ciprofloxacin, trimethoprim-sulfamethoxazole, and gentamicin. C-A-T-S-C-R-A-T-C-H-F-E-V-E-R. Cat scratch fever.